If you're a runner dealing with knee pain that's slowing you down, maybe it hurts to run, you're limping, it's stiff, maybe even told you got knee arthritis and you have to give up running altogether, or that you may even have to consider knee surgery, don't lose hope. There's a better way. In this video, I'm going to show you how you can potentially avoid surgery and continue to run even well into your 60s and beyond. So the problem is most runners think they need to run more and push through it. Stretch and foam roll nonstop. Tape the knee. Swap out shoes. Use pain creams, take pain pills just to get through the runs. But here's what I've learned after working with hundreds of runners. The problem usually isn't the knee alone. It's what's happening above and below, whether it's at the lower back, the hips, the knees, the ankles, whether it's form, the training load, the programming, even the recovery and nutrition plays a big part. In other words, most runners don't have a knee problem. They have a system problem. And the knee is just the alarm bell. All right. And that's why I built what I call the athletic runner method. It helps runners reduce pain, build durability so they can run faster, for longer, train consistently, and stop having to take a break every time they try to build up for like a marathon, right? Stop having to hit the reset button. And what we do is simple. We fix the weak links, rebuild the system, and we keep you progressing without flaring up again. So the 3 steps of the athletic runner method. 1, you got the athletic runner assessment, identify what's actually breaking down. 2, runner strength conditioning, rebuild the body to handle running again. A lot of people don't know this. Running is a high impact sport, anywhere from 2 to 3 times your body weight every time your foot hits the ground. So if you're a 150-pound runner, that's about 300 to 450 pounds of force, joint reaction force as your leg hits the ground. Imagine that over thousands of steps like during a marathon. And then step 3 is developing that running mastery. So your form holds up under fatigue and your body actually recovers between sessions, right? Where you're not feeling like, oh, you do a long run and it takes you a whole week. You can't even go out and do anything because your body is shot just doing one long run, right? There's not a cookie cutter plan. It's not a training. There's just not, oh, here's a training plan. Here's a Google Doc. Set it and forget it. No, it's a personalized method built around your weak links, your injury history, and your goal race. So who I am, you're like, who the hell is this guy? If we haven't met, my name is Dr. Peralta, physical therapist, run coach, exercise physiologist. And I actually deal with years of like chronic knee pain where I thought I even couldn't move. And so what happened to me? 18 years old, I got injured in the U.S. Marine Corps. I was training in the infantry, and that injury changed my life. Where I got medically discharged, and I got depressed because I'm like, man, I can't even move my body. It hurt to like run. I could walk, but I was like limping. And I thought, man, I'm not going to be normal again. I'm going to be disabled. Like, this is just who I am now. I'm not even going to be able to work. And, you know, like a lot of people, I tried different things, went to different doctors, got different opinions, tried pain meds, taping, different shoes, random fixes, but none of it worked. It was all masking the pain. It was temporary, right? It wasn't fixing the root cause. It was only managing the symptoms. And once I finally learned how to rebuild the system the right way, right, I worked with a sports physical therapist, and I turned that, which inspired me so much to use this system to create a framework I now use with runners, what I call the athletic runner method. And since then, I've helped hundreds of runners and counting, many of the runners in their 40s, 50s, and 60s. Right. And now I've been a physical therapist for almost 10 years myself. So I went from that Marine with the knee pain, who, you know, medically discharged, thinking I was going to be a disabled vet, to now a physical therapist, doctor of physical therapy for the past 10 years, helping hundreds of runners, right? Which means that my runners are not just getting fit, they're able to train for longevity, right? And they want to keep running without needing injections or surgery. For example, Mandy overcame chronic ankle pain, shaved time out for marathon. She ran a sub 3:30 marathon. Even went on to run a 100K ultra trail run or ultra marathon, and eliminated hamstring and Achilles pain even after trying PRP injection, after trying cortisone injection. We worked with her there online, and she went on to run multiple marathons. Got rid of knee pain that she was experiencing, even though she was like diagnosed with knee arthritis and was told that she might need to get surgery. And we ended up working together, and she was able to run the New York City Marathon last year. So results vary depending on your effort. Consistency in your situation, right? Everyone's going to be different. Your situation might be different. So how the athletic method runner works. The first step is figuring out why the pain is happening. So it's step 1, the athletic runner assessment. Because if we don't know your starting point, it's like using a GPS without the location turned on. You can't get to the right destination, right? We look at your movement patterns, the squat, lunge, your motor control, stability. We also look at any mobility limitations at the back, the hip, right? The knee, the ankle. A running form. We all do a video running form analysis. And then also look at your training programming, see if you're making any mistakes with the training load or the recovery. Then we build your corrective plan: strength, mobility, mode control, progressive loading, building up that tissue tolerance, elasticity, tendon health. And so you get a personalized plan you could do at home or in the gym. But no commuting is needed, right? You could do this from at home or even if you're working, you do it at your office, no guessing, and we adjust it as you improve. And then step 2, the running strength conditioning. This is where we build a body that can actually handle running. We build up your weak links, specifically strength endurance, max strength, speed strength, power, so you could have a well-rounded attributes so you could handle the demands of running, even if you want to train for a marathon or an ultra marathon. So this is not a generic strength plan. It's running specific and customized to your specific weak links, right? For example, 2 runners can do squats, right, on paper, but one might be limited by their ankles, another by their hips, another loses knee control, and another might have an issue with the core stability or the trunk to stability. So the program should not look the same. It's like, oh, everyone just do squats. No, okay, they might have weak links, and we need to address those weak links so they can do squats properly. And when you also squat properly, that also translates to better running as well. So you got a progressive strength plan, tracked and adjusted. You don't just do exercise. You build measurable durability. You're able to track it the same way you track your PRs with running. We start tracking your strength gains or mobility gains. You can feel confident that you're making progress. Step 3, the running mastering recovery. This is where we make sure you don't just get out of pain, but you stay out of pain and you enjoy running. We dial in running mechanics and fatigue, smarter programming so the mileage doesn't break you, recovery habits, fueling, and nutrition basics. This isn't just about finishing one race, right? You'll just do one race and you're done. No, it's about being able to run year after year, well into your 60s. So let's talk about Fern. Fern, we worked together online last year, and these are her results. And I can't guarantee the same for everyone, right? You might not have the same work effort like she has, the same commitment to doing the program. So Fern's starting point, knee pain and stiffness. She was diagnosed with arthritis, barely able to run. She was stressed out emotionally because running was being taken away from her. Doctors told her she may have to give up running and consider knee surgery, specifically a total knee replacement. And that freaked her out. Fern was about 61 years old, and she didn't want her next chapter to be a surgery. With total knee replacement surgery, I don't know if you guys know this, the recovery could be 6 months, a year. Some people may take like a full 2 years to recover from a knee surgery. And some people never get back to running again, right? So Fern didn't want that, right? She didn't want to be limited by surgery. So what we did, we put her through the athletic runner method. So in 3 weeks, she started getting noticeable relief. 6 weeks, she was back to running. 12 weeks, she ran the New York City Marathon. So the deeper transformation, she just didn't feel better. She got control back. She got confidence back, and she avoided knee surgery. So why it worked? She followed the full system. She committed. You have to have a commitment to following the program. Not just the running, but the strength, mobility, and even the boring stuff that a lot of runners don't like. The recovery protocols that I had in place for her, including sleep, active recovery days, nutrition, eating foods that weren't inflaming her joints, a smart training progression. See, these things outside of running that many runners ignore, what I call this holistic approach to running, to becoming an athletic runner. So again, results vary, and depending on your consistency, your commitment to following the plan to be coachable in your situation. So common concerns. This sounds expensive. Totally fair. Coaching isn't cheap, but what most people don't realize, they're already spending the money on things that don't solve the problem, where they're spending money, random shoes, random clothes, supplements, subscriptions, Netflix, apps, what have you, eating out, drinking, eating junk food, right? Or just buying, eating out all the time, trial and error, trying different apps and programs, right? So the real issue isn't affordability. It's priorities and resourcefulness. Because the thing is, when you look at the stuff that you're spending on, where you're voting with your dollars, you have to ask yourself, is it getting you closer to your goals? And if it's not, you see, hey, cool, where can you get the funds? Be resourceful so you could get coaching, so you can finally enjoy running pain-free, right? Work with a specialist. Some people are like, oh, I'm just going to use my insurance, go to a PT. The problem with the PT down the block is oftentimes they don't specialize with runners. They could get you back to like maybe walking a few blocks or climbing stairs, but they don't know how to bridge the gap to performance. They often let you figure that out on your own, because with the insurance, they just care that you could walk, day-to-day activities of daily living. The other concern I get, I don't have enough time. Most runners think that fixing their pain takes 90 minutes a day or 3 hours a day. But this is usually incorrect, misguided. It's just short, corrective daily work, 10 minutes, 2 to 3 strength sessions per week. And even the running, I'm actually a big fan of just doing running 3 times a week as well. So now you could just condense your training days 3 to 5 days a week and get all the results that you're after. So the real time drain is actually being injured, constantly restarting, losing fitness, wasting months, repeating the same boom-bust injury cycle where you get hurt, go to different doctors, get temporarily better, get hurt again, and you're just wasting time trying to figure this all on your own or doing methods that are partial or incomplete. So what if my case is different? I hear that all the time, especially from runners who say, I have arthritis, too far gone, I've tried PT. But this is not about curing arthritis. It's about building strength and capacity around the joint and adjusting training so you can stop flaring up. Again, most PTs and doctors, they just care about getting you back to day-to-day living. They really don't specialize in working with runners, right? Again, you might get temporary relief because the pain calms down. You're in PT for 3 months or even 6 months. But the minute you start running again, increase the mileage, that pain just comes back because you never really addressed the underlying causes and really understood how to bridge the gap from general pain or rehab to performance, right? So some runners, let me put this clear, some runners may still need surgery, but many don't. A majority of runners who come with me are able to fix the problem following my athletic runner system, especially if they catch it early enough. Online coaching won't work is another concern I hear. I've been coaching online personally since the pandemic, 2020. Online doesn't mean generic. Online means form reviews, check-ins, exercise videos, progression tracking, real-time plan adjustments. You still get coached just without driving to appointments, right? You don't have to come see me in New York City to get in-person sessions. So the cost of inaction, the real question is, what is it costing you to stay stuck? Because ignoring this usually leads to worsening pain, less running, less fitness, more frustration, and eventually that surgery you were trying to avoid. So who this is for? This is for the adult runner who wants to get rid of chronic knee pain, or maybe you're dealing with hip pain or ankle pain that's limiting your running, even back pain as well. Avoid unnecessary injection, avoid unnecessary surgery. Train for a half marathon or a full marathon, or even an ultra marathon without having constant setbacks or having to take a break every training block. Run for longevity as your age, run into your 60s and beyond. This is not for the people who want a quick fix, who want to keep masking the symptoms, who aren't willing to follow a structured plan, who aren't coachable, who they're just going to wing it or they're just going to dabble. They're okay taking pain pills and just ignoring it, pushing the pain, right? This is not for you. So the 3 options. The first option, keep doing what you're doing. Keep managing the symptoms, masking it, putting some tape on it, taking some pain pills or cream, and hope it doesn't get worse. Option 2, keep trying random fixes online. Try to do trial and error for the next few years. It may take you 5 years, it may take you 10 years, it may take you 20 years. Heck, you might not even figure it out and just live for the rest of your life with pain and maybe get that surgery you're trying to and end up getting that knee surgery as you get older. Or option 3, shortcut the process. Work with an expert like myself, someone who's a physical therapist who specializes with runners, understands performance, with a proven system, and rebuild your body the right way. So if you want to run pain-free, avoid surgery, and build durability for the long run, click the link in the description and book a free consult call. On the call, we'll identify what type of pain you're dealing with, whether it's, even if it's, you're like, but Ray, I don't have knee pain. I work with people with back pain, ankle pain, hip pain. We'll try to figure out what is the cause of the pain, what is the mechanical cause, what other causes, what other things you may be missing that's contributing to your pain story, and then see if you're a fit for the program. And map out, getting you the roadmap for the next step so you could enjoy running and for longevity and run pain-free. I only take 10 clients at a time because I want to give, personalized, private, one-to-one attention to my runners and give them real coaching. Right now, I already have 7 spots taken. So don't wait. Click the link in the description and book your call, your free consult call today to get your roadmap so you can learn how to implement the athletic runner method for your unique situation.